Psychedelics, as a class of drugs that alter human perception and mood, have throughout history seen varied usage, from cultural and spiritual rituals to psychiatric experiments. Today, the therapeutic potential of psychedelics is being revisited under the lens of modern scientific scrutiny. Historically, the use of psychedelics dates back thousands of years, playing a significant role in ancient cultures. Spiritually minded societies use substances such as peyote, ayahuasca, and psilocybin in their rituals. In the mid-20th century, the medical world embraced psychedelics, most notably duo Humphrey Osmond and Abram Hoffer, who trailed the potential of LSD as a treatment for alcoholism. However, socio-political factors led to the prohibition of these substances, stalling research into their potential medical applications. The scientific interest in psychedelics was revived in the 21st century, as they presented potential solutions to issues unaddressed by conventional treatments. For instance, participants in trials involving psilocybin for treatment-resistant depression reported significant and sustained improvements. Similarly, in trials on end-of-life anxiety and depression in terminally ill patients, MDMA, also known as ecstasy, and psilocybin have shown promising results. Recent research has also suggested potential therapeutic applications for psychedelics in the treatment of substance misuse and addiction. LSD and psilocybin have shown to assist fundamentally in reducing reliance on alcohol and quitting smoking, respectively. Psychedelics like ibogaine are now being considered for opioid addiction, a critical and challenging sphere of public health. Psychedelics have been observed to have a profound impact on brain functionality, increasing plasticity and connectivity. This change disrupts pathological thought patterns and promotes a kind of reset effect, opening up the potential for establishing healthier ones. Considered radical and nonconformist, the psychedelic experience is characterized by dissolution of the self, objectivity of life's experiences, reevaluation of priorities, all of which have profound therapeutic impacts on the user. However, while exploring the therapeutic potential of psychedelics, it is equally essential to acknowledge their risks and negative consequences. The experiences induced by psychedelics can be profoundly intense and overwhelming, leading to acute anxiety and panic reactions. Significantly, individuals predisposed to psychotic disorders can face a severe escalation of symptoms, which underscores the importance of medical supervision in their use. An important ethical consideration is the risk of over-commercialization and misuse of these treatments if they become mainstream without the necessary safeguards. Already there are concerns about the uninformed usage of psychedelics and a trend towards self-medication that can have serious implications. Furthermore, it is important to note that the positive response to psychedelic treatment does not solely depend on the pharmacological actions of the drug. It is also closely interlinked with the psychological preparation, the therapeutic alliance built between the patient and the provider, and the careful integration of the experience into one's life, typically referred to as set and setting. Despite the growing interest in the field, psychedelic science remains in its nascent stages. One of the critical challenges facing the scientific community is the stigma associated with psychedelic usage, which often results in regulatory hurdles and gaps in funding. To fully unlock the potential of these substances, a significant shift in societal and regulatory attitudes is required. In summary, while the therapeutic potential of psychedelics is promising and has already demonstrated impressive results in a variety of mental health conditions, it is necessary to approach these substances with due diligence and caution. More rigorous, large-scale studies are necessary to demonstrate their safety and efficacy fully. With an ethically sound, controlled, and scientific approach, psychedelics can potentially revolutionize mental health treatment and offer hope to those who found little in conventional therapeutics.